If you want a successful AFib ablation, you have to know this. If you have had an AFib ablation procedure or are thinking about having one, you're not alone. More than 20 million AFib ablation procedures are done each year in the United States. You likely know AFib ablation can be an effective treatment for selected people with AFib, but it's not perfect. Recurrent AFib is more common than anyone would like after ablation, but did you know that you may have the most power in whether your AFib procedure is successful or not? You want the best results from your AFib ablation, and you know there are many factors that are important, such as the experience of the doctor in the hospital or how long have you had AFib. However, you may not be aware there are strategies that you can follow that are likely even more essential in whether you have recurrent AFib after ablation or not. The unfortunate reality is AFib tends to get worse over time. The reason for this is most cases the underlying cause of the AFib is not addressed. And when we don't address the underlying cause, we are unlikely to cure the problem. An analogy would be treating chest pain caused by a heart attack with painkillers and not by opening the blocked artery. This approach would not make sense to anyone, and the same thing applies for AFib. To get the best results, we need to address the underlying cause. The power of treating the cause, or the risk factors for AFib, was demonstrated in a research study called ARREST-AF. In this trial, the researchers evaluated people who had an AFib ablation who were then randomized to treatment that addressed the cause of the AFib compared to usual care. The specific causes of AFib addressed in this study were unhealthy weight, uncontrolled blood pressure, high cholesterol, sleep apnea, smoking, and excess alcohol. The results were remarkable. Those in the treatment group lost 29 pounds on average while lowering their blood pressure, blood sugars, number of medications, and their amount of recurrent AFib. At the end of the study, those who treated their underlying risk factors for AFib were 87% likely to be free of AFib. Those who did not, only 18% of them were free of AFib. If you have had an AFib ablation or are going to have one, it's essential that you have the knowledge and support you need to ensure a successful result. Talk to your doctor about the ways you can lower your risk for AFib, and if you would like to learn more about how our MD Team Healthy Weight program helps those with AFib lower their risk, click the link below. And if you don't connect with us, find a doctor and the support you need to lower your risk from AFib and give yourself the best chance for a successful AFib ablation. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.